Hi, FreeBody Massage family. Kat here in Asheville, and I'm introducing you to a video as promised, Trapezius and Levator Scapula anatomy, discussion of the trigger points, pain referral patterns, how they get into a mess. You're going to learn that right now. So I already released a treatment video, and I'll put a link in the description to that video. But it's really helpful to understand how to work with these muscles, why you need to warm up first, which side to start with, why these muscles get dysfunctional. You will be able to help so many more people if you watch this video right here, because you're going to understand their neck pain more. You're going to understand their shoulder issues more. You're going to understand their headaches more if you have this understanding, because it's going to teach you the reasons why these muscles get dysfunctional, the main reasons, and where the trigger points live and what those trigger point pain referral patterns are. So you'll know, oh, pain in the side of the neck. Oh, I need to treat trapezius, not the side of the neck. So do watch this video, give a like, subscribe to the channel, then go ahead and watch that video on the treatment. Again, that video is in the description. So also to know that this video of the anatomy of trapezius and levator scap, I recorded this for a continuing education course. So if you're a massage therapist in the United States, you need CEs. I'm going to put a link to that course and my other online CE courses down below. Also, it really helps me if you need CEs. I'm a nationally I'm a nationally certified CE provider. Check out my courses, check out this anatomy teaching, and I'll see you in the next video. Hello and welcome. Welcome to the Trapezius and Levator Scapula course. My name is Kat Matlock here at FreeBody, and I'm happy to share this course with you. You are going to be able to help your clients with all kinds of neck pain, neck and shoulder issues by doing this one course. These two key essential muscles. It's essential to know how to do really good work in these muscles. It is transforming. It is life changing. So let's get started. Let's talk about trapezius and the levator scapula. So these two muscles live in the back of the neck and the shoulder. And actually trapezius, as you know, is huge. It's a big muscle, goes all the way from the base of the skull down along the back of the neck, along the top of the shoulders, attaches along the spine of the scapula, which you can see right here in the picture. And then it goes all the way down to around T12. Now, this muscle, its tendon weaves into the thoracolumbar fascia. And the thoracolumbar fascia is really key part of the body when you're dealing with people who have chronic lower back pain. Thoracolumbar fascia is often the place where this pain is lodged. So it's helpful to know how to work with all the muscles that weave into that thoracolumbar fascia. Trapezius is one of them. So even though, yes, you're going to work on the trapezius with your clients with neck pain, with shoulder issues, with base of the skull problems, with headaches, you're also going to want to do some trapezius work on your clients who show up with back pain, because this trapezius is weaving its way into that thoracolumbar fascia and might be contributing to some of the problems there. And we're going to talk a little bit about how this muscle gets into trouble in just a moment. Now, this levator scapula comes up along from that superior medial angle of the scapula of the shoulder blade, does its little twist, and then goes up and attaches along the sides, the posterior tubercles or transverse processes of the cervical spine. So it's literally pulling on the cervical spine and can significantly contribute to neck pain. This muscle is totally jacked, and so many people, so many of your clients need this work. But to work deeper, to work beneath the trapezius. You have to go through the trapezius. So you don't want to just start your work on levator scap. You got to get through and soften the trapezius first, which is why I put these two muscles together. So let's get into a little bit more about our friend the trapezius. Trapezius does a bunch of jobs, right? The traps extend the head and the neck. They turn the head and neck to the opposite side. They depress, elevate, retract, and rotate the scapula upward. That's a lot of things. Also, that middle trapezius is contributing to the shoulder blades drawing towards each other. So that's that retraction of the scapula. And they can ache along the rhomboids line. So your clients might say, oh, I've got this aching in between my shoulder blades. The first thing you're going to think is probably rhomboids. Well, yes, and trapezius also causes aching between those two shoulder blades in the area of the rhomboids, as well as all along the top of the shoulder, as well as at the base of the skull, could be along the back of the neck, and often trapezius radiates pain up the side of the neck, kind of almost along where the levator scap attaches, and wraps around the side of the head, anchoring some pain in the temple, anchoring some pain behind the eye, and even contributes to lower jaw pain. That's a busy muscle. That's got a lot of stuff going on. So your clients who have aching in their jaw, who have eye strain and pain in their eye or behind their eyes, who get headaches that lodge in the temples. They might say, yeah, my neck aches so much and I get headaches. They might not put those two symptoms together. Trapezius is the number 2 cause of headaches. Sternocleidomastoid is the number 1 cause of headaches. So you might want to put that other course in your pocket, the sternocleidomastoid and splenius capitis, because if you have people with headaches coming to see you, you'll want those skills as well. You'll want to know how to release sternocleidomastoid, and you'll want to know how to release trapezius. Now, here's something interesting about those trapezius headaches. They also have a nauseous quality to them. Nausea. If your clients have headaches or migraines with nausea, very well could be coming from that upper trapezius along here. Now, you can't just grab the upper trapezius and hope for the best. You've got to get really specific. And in the videos of the work, I demonstrate very specifically how to get into that upper trapezius. It is essential for you to get to the right place. That's trigger points, right? Trigger points are focal points of tension. It's not just grab the top and squeeze and hope for the best. That feels good, but you've really got to get along that very top line. Now, I'll point out that this picture, the old Travell and Simon's pictures, show 2 X's, 2 trigger point locations in the upper traps, and then 1 down lower in the middle trapezius. If you just follow these pictures, you'll have some benefit, but I'm going to show you really specifically where those trigger points live. I'm adding in a 3rd trigger point that is almost always there with people with headaches, right? So just because the maps show this is where these trigger points are that we studied, doesn't mean there aren't other trigger points in the body. So in the upper trapezius specifically, there is a point that's really close to the neck, the furthest in that you can get on this muscle to release for your clients with headaches. They always have that one, and they'll tell me, oh yeah, that's making my headache come on. That's okay. When you're working, you want to help them breathe, encourage them to breathe, ask if they need less pressure. That your communication is always, does that feel important when you're squeezing a little trigger point? Do you want more or less pressure? And you'll get some of that training in the what is a trigger point and how do I treat it? But I just want to point that out. You really want to be communicating with your clients as you're treating them. You want to keep them engaged, because then you know you're not always going to be able to feel trigger points exactly where they are. You might be feeling something really thick, but it could just be a little fascial adhesion, a little bit of connective tissue binding there. You don't know. And even after 30 years of doing this work, I don't know. I've refined my palpation skills, but still I communicate with my clients and I ask them to keep me in the loop, to let me know how they're feeling. So the trapezius is also touted as the number one place in the whole entire body to hold tension, to hold trigger points. Why is that? So many people walk around with their shoulders up by their ears, or they have one shoulder that's lower than the other. This side, that trapezius is going to be short and sticky and locked up with some trigger points. This side, the lower hanging shoulder, is also going to be loaded with trigger points. And here's the thing that is so essential to understand. The long side is almost always the side crying out in pain. I can't tell you how many people have come to see me and they're like this, and they're leaning their head off to one side, and they're like, oh, this aches, this shoulder hurts, my base of my skull is just aching, my neck hurts. So I'm stretching it and stretching it and stretching it. And I'll say, yeah, and that never works, right? And they're like, no, it never feels better. It always feels tight. Well, exactly. It's the long side. It's already taut. It's already pulled taut. And so it's helpful to educate your clients on the difference between tight and taut. Tight and short is this side. Long and taut is the other side, is that shoulder that's hanging low. Almost invariably, not always, but almost invariably, it's that long and taut side that's crying out in pain. That's where they're feeling their neck pain and their trigger points. And I recently, even though I do this work all the time, I work on myself all the time, I recently was like kind of mindlessly rubbing the side of my neck and rubbing the side of my neck and feeling my neck was tight. I thought, oh, my neck's a little tight today, and was kind of rubbing it. It wasn't working. It wasn't getting better. And I went, oh, stop being mindless about it, Kat. Pay attention to your body. What's your body telling you? Oh, this shoulder is that trapezius is loaded with trigger points. So I started releasing that side, releasing that trapezius, and my neck aching went away. True story. And fabulous story. This is the kind of stuff you want to get good at so that you can help your clients and guide them. Just that understanding. What's taut and pulled long is often the part that's causing the pain. So now we're going to get into our friend Levator Scapula. Levator Scapula elevates the scapula or lifts them up, right? And it resists forward head motion of the head. This is key. This is the big ding, 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 ding of the Levator Scapula, because almost everyone has text neck, right? Almost everyone is looking down at their phones all the time like this. Don't do that. Don't do that to yourself. Part of the job of Levator Scapula is to keep the head from dropping forward, because that's a big strain on that muscle and on the other muscles, the other posterior cervical muscles, the trapezius doesn't like that either. That's going to cause problems. Both trapezius and Levator scap are trying to pull the head back over the shoulders. So for folks who sit in a couch and are always like this, for folks who text a lot, looking down at children a lot, or looking down at their laptop, they're constantly putting a strain on that levator and on that trapezius. Now, I'm in the midst of writing a book right now as I'm recording this. I'm also working on a book. And one of the things that I put in there that I learned from Tom Myers, the anatomy trains fascia guy, is that the connective tissue around the muscles gets thicker and denser and less hydrated. And when fascia becomes less hydrated, it gets sticky. So the first thing you want to do, you don't ever want to start by just going into the trigger points, because muscles with trigger points, their fascia is also thicker and stickier. So I'm including in this course a video on warming up the upper back and shoulders. Don't skip the warm-up. It's so important. You're flushing that area with fluid. You're bringing more hydration, which immediately softens the fascia and the connective tissue there. That's going to help the muscles relax already before you even start doing your trigger point work. Then you can go in and get real specific in those trigger points and really make a positive effect, make a big difference in your clients. So that levator scapula, I would say, for folks who walk around with their shoulders up like this, or for folks who hang their head forward, those are the two main causes of trigger points in the levator scapula. Other causes of trigger points in levator scap and trapezius is ladies with big breasts who wear really big, tight bra straps can press on the trapezius, press on that area and cause trigger points. Someone who holds a heavy bag on one shoulder and is always kind of like this, that's definitely going to cause some trigger points in levator scap and trapezius. Someone who has one hip that's higher than the other, and when the pelvis gets off, the whole torso is off. So if someone has one hip higher, often that shoulder is higher, and the other one is long and low, hanging, trigger points, right? Or they lean toward that side. They're curled up almost like a C, like curled up like this, and that is shoulder hangs lower, and that's the side with the pain, the headaches, the neck aching, and the problems. So I just wanted to lay that all out for you because I think it's helpful to look at the patterns in your clients, look and see, how do they sit? How do they stand? Are they cutting off all of their circulation by wearing too tight of a bra strap? Are they always carrying a heavy bag on one side? Do they stand with their weight on one side and one hip jacked up and that shoulder kind of either up or dropped down? Are they reading in bed? Are they texting all the time? Are you texting all the time and looking down at your clients all day long? You need this work as much as your clients do. So every once in a while for yourself, get up, look up, open your chest, lift your chin, squeeze your shoulder blades up, do some circles, keep that tissue hydrated and moving so that you don't start having these problems in your own body. So in the treatment section, you're going to have, you have a talk about trigger points. You also have an excellent warm up, like, what are we doing here? Let's warm everything up, get it soft, get it hydrated, get it smooth. I promise you that's going to make your trigger point work 10 times more effective at least. Then you're going to get into that upper trapezius. You're going to release that middle trapezius. Then you can go deeper into levator scap, and your clients will be singing with sighs of relief and singing your praises all over town. So let's get started on the work.